Okay, we'll start over. Welcome, good morning, and a little bit later morning for those joining us for the Twitter and Facebook for Health Best Practices webinar. Please let us know in the chat box if you're having a difficult time hearing me. Hopefully the volume is okay. My name is Lisa Peterson, and I'm a new media education specialist with the California Pacific Public Health Training Center here at UC Berkeley School of Public Health. And we're very happy to sponsor the webinar today with the Center for Health Leadership. And this is the first webinar in our latest series called Create, Connect, Collaborate, 21st Century New Media Trainings. And we aim in this series to provide opportunities for health professionals to learn how to strategically use new media for public health practices and healthcare. I'm going to be your moderator today to help facilitate the discussion. And before we dive in, just a couple of reminders. Please be sure to mute your phones by pressing *6. And we'll also put some reminders and instructions for that in the chat box as we go through the webinar. And also, as I mentioned, know that we're going to be recording both the webinar's audio and chat features. So if you don't want to be recorded, please refrain from talking or using the chat feature. So today, we are going to be hearing from Mike Lawson from the Diabetes Hands Foundation. He's going to share Twitter best practices. We're also going to be hearing from Megan Cannon from the San Francisco AIDS Foundation, who's going to share about Facebook best practices, as well as Bhupendra Sharan from the Internet Sexuality Information Services, or also known as ISIS. He's going to also share about Facebook best practices. And a little bit about what we're going to cover today. I'm just going to give a little bit of a review of the session objectives. I'll introduce our first speaker, Mike. Mike will present on Twitter for Health, and then we'll have some Q&A time after his presentation. And then we'll also follow for Facebook for Health with Megan Cannon, and we'll follow that with some Q&A. And then we'll have our final presentation from Sharan about Facebook for Health, and we'll wrap that up with some question and answer. And then we'll conclude with some resources and some action steps to take at the end of the webinar. And in terms of the objectives for today, we'd really like to give a sense of how you can use these new media tools to further your organization's goals through the examples and strategies that our presenters are going to share. And these might be goals like engaging more deeply with stakeholders, finding a voice that resonates, and finding purchase with the audiences that you're trying to reach. Or it might be that you're using Twitter and Facebook, but you'd really like to hone in on how to measure what you're doing to see if you're having the impact that you're aiming for. And we did want to share a little bit about who's in the audience today. We have a really diverse representation across occupations in public health. And we're also having people join us from far afield as far as Australia, and also quite a few folks from Hawaii, so welcome. And just a few housekeeping items as we move forward. Please be sure to have your phone, as I said, on mute by entering *6. And throughout the webinar, if you have a question, feel free to type that in the chat box, which is on your screen in the lower left. And we'll be sure to monitor that as we go through, so we can hopefully address that during the Q&A session following each presentation. We can get to your questions. And before we launch into our first presentation with Mike, we wanted to do a poll and find out what people are doing currently with Twitter and Facebook. Please select the option that best describes your current use. It looks like we have some responses coming in. I'm going to show you how we have those coming up. So we really want to learn how you're currently using Twitter and Facebook. And sorry how Facebook is not quite showing up there in the field there. But it looks like we have quite a few people that are wanting to take it to the next level. They're starting. We have some folks that haven't started just yet. And hey, we have some rock stars out there. That's great. So This is wonderful. Looks like we have some good responses in. It gives us a sense of who we're joined by, our peers in the audience. So before we launch into the first presentation, I want to introduce our first speaker, Mike Lawson. He's Head of Experience at the Diabetes Hands Foundation. And Mike is passionate about diabetes advocacy, and since his type 1 diabetes diagnosis, has used social media to find and give emotional support to others that are living with diabetes. He's worked for over 10 years in nonprofit management, and he's been pushing the organizations that he has worked for to adopt new media in their marketing plans since before it was cool. And at the Diabetes Hands Foundation, Mike is responsible for the overall user experience, and he also oversees the development of the visual identity and branding of the organization, and he's the program manager for the Big Blue Test, which he's going to share with us, which is an online initiative that emphasizes the importance of physical activity to help with diabetes management and raise money for diabetes-related charities. So welcome, Mike.
Hi, you guys. We're going to just jump right in. As Lisa said, I'm going to be talking about our use of Twitter, and I am going to go over a few things with you guys. We're going to spend a little bit of time talking about the Twitter language, not too much on that, but we're going to answer the questions, why Twitter and why now, and we'll spend more time talking about how we've raised money and community awareness through Twitter, and I also want to talk about how we measure impact, ultimately trying to explain how Twitter has become a valuable tool for our organization. And then I'm going to explain some steps you can take today to get started. And then if time permits, I will also do an acoustic version of Simon & Garfunkel's Bridge Over Troubled Water. I'm just kidding. I don't actually sing. So The Who. We are a Berkeley-based 501c3 organization. We have been connecting and engaging and empowering people living with diabetes since 2008. We have a pretty active Facebook page, a YouTube channel. We have about 12,000 followers on Twitter, and we engage people and connect them through a variety of programs and initiatives. We have 2 online communities with more than 40,000 registered members. We publish a book called No Sugar Added Poetry that contains poems written by people that have been touched by diabetes. And we have some other programs too. And one that I'm going to focus on a lot today is Big Blue Test, because we certainly use Twitter in that campaign. And the Big Blue Test stresses the importance of physical activity in diabetes management, like Lisa just said. And we'll be talking more about that in a minute. Who am I? I've actually been a 2 Diabetes member since 2008 when our organization launched that website. I have type 1 myself, and I'm a diabetes advocate. I use Twitter and YouTube, and I am also the head of experience. So I am involved in all of the social media efforts with our organization, and I am also the program manager for the Big Blue Test. So that's important because we'll be talking about it in a second. And then I'm really good at helping people get things off of the high shelf in our office as well. Next slide. So why Twitter? Why now? On the screen I have a stat from the Cone 2009 New Media Study that shows that 95% of social media users expect companies to have a presence on Facebook, Twitter, or YouTube. And the most recent version of this study actually showed that in 2008, 59% of people surveyed preferred to interact with companies and brands online compared to telephone or face-to-face interaction. And that number increased to 78% in 2009. And then by 2010, 86% of people surveyed said they would prefer to interact with companies or brands online. So people are turning this direction, and we are responding to that. So Twitter is one way that we talk directly to the people. Depending on what your organization does, what services you offer, those people could be different. It might be clients you serve, it might be donors, it might be people in industry, but this is where people are and this is where we're talking to them. So I kind of plan to go over a lot of different terms, but for time, I'm going to skip some of this, and I really want to just kind of explain what a hashtag is. It's the pound sign, the number sign. This is a way to note that a topic of conversation is linked to a larger discussion. So we're going to be talking a little bit about hashtags in a minute, so I wanted to make sure you guys knew what that is. All of these terms are important, and as Lisa stated, there's going to be a resource slide at the end of this, and I included a couple of links. One of them is a beginner's guide to Twitter that goes over all of these terms and then some. So if you're a complete novice, make sure you click on that link that we're going to show you in a second. So with the hashtags, on Twitter we our organization responds to conversations that are happening to hashtag diabetes. We promote work when people hashtag diabetes in their tweets, and then we promote our own work with hashtag diabetes. And I'm going to show you a few examples and kind of show you how we've responded to them. This is a tweet that came a few weeks ago. My BG is so high, my blood glucose is so high this morning, I hate hashtag diabetes. So this is just somebody venting. It's a regular person, somebody that could definitely benefit from our services. And they are reaching out to a huge conversation that people are having about diabetes by including the hashtag. So we responded to this tweet. We said, how high is high? We got a number. We responded and said, that stinks. Are there any explanations? A very casual conversation, but a relationship was created. Another type of tweet that happens with hashtag is somebody who's super reputable. So JDRF is the Juvenile Diabetes Research Foundation, and they published a study on diabetes and smoking, and we retweeted it. We told our 12,000 followers that this is something that we think they might want to check out, a new study on diabetes, and there was a link involved. So we were spreading knowledge that we thought was legit, and we created a relationship then with JDRF. And then we posted, this is a tweet that we actually did, and it's diabetes and exercise can help charity with a link to the Big Blue test. And our hope then was that we've created a relationship with the person that was venting about diabetes, and they might click into this link and help us with our program, or they might retweet this link and send it to their followers. And then the JDRF also would retweet this link and send it to their followers. So we've built relationships through responding to tweets and to spreading, promoting other people's work. And then when it comes time to promote our own work, we had relationships already. So people monitor the hashtag diabetes discussion just to see what people are saying. So there are 12,000 people that follow everything we say on Twitter, but there's even more people that are following hashtag diabetes that maybe don't follow us, but we can convince to follow us and look into our work because of the hashtag. So the Big Blue Test is a program that we do every year. It's an annual program that promotes the importance of physical activity in diabetes management. We ask participants to test their glucose, get active for 14 to 20 minutes, test again, and record those results online at bigbluetest.org. And the average person is seeing that their blood glucose is going to drop about 20% after 14 to 20 minutes of moderate activity. So people that participate in the Big Blue Test are helping themselves, but additionally, 20,000 Big Blue tests actually triggers a $100,000 donation from a program sponsor. So we certainly want to make sure that people are doing the Big Blue test and seeing these wonderful results and getting physically active, but we also want to trigger this very large donation, and we want to get a lot of people to do the Big Blue test. So we created a hashtag, a Twitter discussion. The hashtag facilitates the discussion around our program. So our ultimate goal was to get as many people to click into bigbluetest.org and take the test. So this is our website here, and you'll see at the bottom there's about 9 questions. You can't see all of them on the screenshot, but there's about 9 questions that we need people to enter results for. And you'll also see on the right all of those pictures there. Those are all, actually I have an arrow over here. These are all pictures that were generated by people that included hashtag Big Blue Test. when they uploaded a picture to Instagram or to Twitter. So in a way, this is kind of payback for, or this is payment for, it's a reward for people that are doing the Big Blue test. We're featuring their pictures on our website. And then we also, because of Twitter, we have instant access to people that are participating in our programs. So somebody might tweet that they just did the Big Blue test, and I can respond, how you doing? How did it go? I can offer motivation. I can retweet that and show people that other people are doing our program. And then I featured this guy, Richard, I believe. Rich did the Big Blue test. I found him on Twitter because he was tweeting about it. And then I turned that story into something longer on our blog so that I can show that people are getting true benefits out of programs that we're offering. So I had instant access to somebody in our program. I could also congratulate people online and that sort of thing. So our pictures that we got were very diverse. We got instant access to a lot of people doing all different kinds of things with the Big Blue Test hashtag. Some people loved our shirts and our merchandise. Other people did basketball or dancing or ice skating, all kinds of activities. Also, the thing with Twitter, this is maybe a cautionary tale. This one isn't that bad, but when you open things up on Twitter, you are also opening it up to the world. Anybody can respond with hashtag Big Blue Test, and anyone can see it. So if somebody had super negative things to say about your program, they also could chime into that discussion. But in a way, that's kind of beautiful. Everybody can truly express their feelings, and you have no control over that. What we do have control over, however, is the character of our organization, the likability of our organization. So this user wanted to know if she should wear tights with her Big Blue Test shirt or not. And we could have ignored that because it has nothing to do with our mission, or we could respond that we think she should certainly wear tights or that she shouldn't. We actually said stylish and helping diabetes charities. We love it. So you have control over how your organization is seen. Ultimately, we did reach our goal of 20,000 Big Blue tests this year. We got 24,000 Big Blue tests entered actually. We were 2 days early. We blew our lofty goal out of the water. And Twitter was a major influence here. I can tell you it was a major influence because I was on Twitter all the time and I saw all of the conversation around Big Blue Test. I saw all of the photos on our website that were being featured. But I actually have harder data too. We have Google Analytics set up, which most of you guys probably have set up on your websites. Whoever runs your website might know that. We saw that 20% of our traffic during the campaign came directly from Twitter. I'm guessing that probably a higher number than that was actual Twitter influence. It's hard to measure, who saw us on Twitter and then ended up typing in bigbluetest.org or saw a link on Twitter and typed it in later. 7% of the traffic that came from Twitter, 7% of those people actually completed the Big Blue test, which is pretty high. Facebook was slightly higher, but still great numbers. And then we also used the URL shortener, bit.ly, bit.ly. What you can do with that is you can create short links to use with your tweets, and they give you analytics on how each link is performing. So, for example, we learned that asking people to retweet a link will spread the message really well, but people don't click it. So we did find, though, that videos make people click. So if we said, watch this video now with a bit.ly link, that got clicked significantly more. And then our highest performers actually were links that related to a current event or a trending topic. So I wrote a tweet that said, today is election day, walk to the polls and enter your Big Blue test. And there was a link to our website, and that one was one of our highest performers. So I am getting close to done. I wanted to go over some quick things. I have 11 things you can do right now. I'm not really good at numbering. For some reason I have 2 number 6s. So you'll get 11 things instead of 10. Something you can do right now, I suggest that you claim your name. There's a good chance that you might have some red tape and you might have to get approval to start tweeting. You might have to go through the process. But before you do that, there's nothing wrong with logging in and claiming your Twitter name now before somebody else does, or before somebody else does. That's really why you should do it. And that's free and can be done right now. You don't have to start tweeting if you're afraid that you need approval or something, but you can certainly claim the name now. You can also find existing hashtags already. Search common terms that relate to the work that you do. So hashtag diabetes made tons of sense for us. But there's also DSMA is a hashtag that we follow very frequently. It stands for Diabetes Social Media Advocacy, which you would never guess. But once you start following hashtag diabetes, you see that hashtag come up a lot, and you'll start learning. I would also find the vocal, well-followed people that are tweeting in your service area. So this could be a geographic area. So like a local news reporter probably has a lot of Twitter followers, or it could be industry specific, like how I follow the Juvenile Diabetes Research Foundation. So find those people and start following them. Participation is also really important. Remember that you're having conversations on Twitter. So you should be responding without selling or marketing anything, just responding for the sake of how are you doing today, or oh my gosh, high blood sugar, what did you do, or low blood sugar, what did you eat, how did you bring it up, that sort of thing. Conversations, not selling or marketing anything. And then I also suggest that you follow the competition. I put it in quotes because I don't know if it's the right word for the nonprofit world, but you should find organizations that are doing what you do, see who they follow, see who follows them, and then see what they tweet. I also think that you should find your voice. Most successful brands on Twitter, in my opinion, aren't spewing links at everybody or peddling products. They're just talking to people. They're building relationships. And I would also suggest, this is what we do, and I would suggest that you do this. We have a limited number of people writing tweets so that there's kind of a character behind our Twitter account, and we can build relationships with people that are truly genuine. This is the second number 6. You should talk. Don't wait for people to follow you. Just start tweeting. Some people are hesitant. They don't want to tweet if nobody's following them, and I feel like I don't want to follow somebody if nobody's tweeting. So just start talking, and people build it, and they will come. There's also a rule out there. I didn't come up with this, but it's called the 60-30-10 rule, and the idea is that 60% of your tweets should be retweets or point to items that you didn't write but that you find or that you think your followers will find interesting. 30% of your tweets should be conversations and responses, and then only 10%, a very small percent, should be announcements or links or self-promotion. And you're going to be relying on the relationships that you've built with the 60 and 30 to help you promote those 10. Number 8, I said ask questions. They're great conversation builders. What's your favorite glucose tab flavor? Generates tons of responses because you're just curious about the actual user. Number 9, be genuine. We're sold products all the time. Twitter is the same. And we know when people are fake or if it's an automated RSS feed. So be real, create real relationships, and you'll get real benefits from that. And then the last one is super easy. Just do it. I don't have much else to say other than that. Just get started. And Twitter is one of those things that you'll learn as you start doing it. So my contact info is all over the end of the slides. I suggest you follow me on Twitter if you'd like. Follow the Diabetes Hand Foundation. If you have questions later after this webinar, feel free to contact me on Twitter or email. And that's pretty much it. So I guess now we are going to do some questions if anybody has any.
That's great, Mike. Thanks so much for especially all those start now tips at the end. And just to let everybody know, we are going to take a few moments now for some Q&A with Mike. And a couple of options. You can send Mike a question or comment using the chat box in your lower left. And you can also raise your hand if you want to be taken off mute to ask a question verbally. Let's see, Susan. See if we can get you. Susan, if you can go ahead and press *7 to unmute your phone.
Is that me?
Yes. Is that you, Susan? Hello, welcome.
No, Susan. No, sorry. This is the registrar. It's you.
Oh, hello. Hi. My name is Lisa, and I'm calling from Department of Public Health in California. Can you hear me?
Yes, we can, Lisa. Thank you.
I'm just curious how you deal with issues of kind of, we all talk about HIPAA and privacy, and, here you are. People are, I guess they self-identifying themselves, so maybe that's what kind of is the area, that protects you to a certain extent as an organization. But, I'm just wondering how you deal with the issue of privacy. And, you even have photographs of people, and people put it up. And, just what's the context for making this all okay in the world where privacy and confidentiality is just such a big, big issue?
Well, you hit the nail on the head. This is all user-generated content, so I'm not promoting people to share anything they're not comfortable with sharing, and I'm also not retweeting private information because it's all something that's already been put out in public. But then I also have to say I'm not a healthcare provider, so I'm not following, the same set of rules that maybe somebody who is receiving private information is.
Okay.
A good question.
Just curious about, the framework for how you think about how all of this is okay to be done. But fine. Thank you.
Thank you. And Mike, we also have a great question from Will Harper, who works in a local health department. And it's a complex organization, and they're doing everything from vaccinations to hazmat response to restaurant inspections. And the question really is in terms of how challenging that can be to create a community as opposed to being focused on something very specific in one area like diabetes. So the question is, how do big organizations with many or multiple missions create community?
That's a wonderful question. If any of the other presenters have any input, I would love to hear that too. I would suggest kind of trying to focus one at a time on the different areas they service and try to build a community around each. I don't know if anyone else has other input on that.
Yeah, Megan and Sharon?
Yeah, I'm sorry, this is Megan, and I'm from the San Francisco AIDS Foundation, and we have multiple programs and services that we offer underneath the umbrella of our organization. And so we have an ongoing conversation on kind of what is the voice of the San Francisco AIDS Foundation versus Magnet, which is our gay men's health clinic, or Stonewall, which is our substance abuse treatment program. I think it depends on the different programs that you think are interested in getting involved in the social media sphere, and if it's appropriate for them to be participating in conversations on like Twitter or Facebook. And that can be on a program level, or if you're interested in having more of like an organization voice, then I say go with like your overall mission and kind of develop whatever personality or voice or message that you're trying to reach out to the people you're trying to bring into your organization.
Thank you, Megan. And looks like we have time for at least a couple more questions. Mike, we have some questions from Carolyn Mather and Monica Levy, kind of the nuts and bolts in terms of how many hours a day are devoted to tweeting, and then also maybe getting at what motivates people to reply to tweets or to engage with organizations via Twitter at all.
Yeah, both really great questions. I would say that to Carolyn's question about how many hours we devote to tweeting, social media is a 24/7 thing. We don't ever turn Twitter off. People are always responding and always tweeting because it's worldwide, and because people, do it after work. They do it, in the wee hours of the morning. They do it on their lunch breaks, and they do it while they're supposed to be working as well. We are always monitoring Twitter. we kind of have a plan set up so that certain people are set to respond on a certain day. So I, for example, take Saturdays, and one of my coworkers takes Sundays. And if somebody has a specific tweet to our organization, we will respond. So it's a 24/7 thing, really. And what was the other question is what motivates people to reply to tweets? I think I touched on it hopefully in the presentation. It's a relationship. You have to build that. Don't start by asking people to retweet your stuff. Don't start by asking for favors. You have to have a good relationship with people. They should trust you as an organization that is really there to help the conversation and not just there to promote the work that you're doing. So I think because of that, we've had a really good success rate at getting people to help us promote our work on Twitter. Adam also posed a question about if we only use Bitly and Google Analytics. We actually use Hootsuite and Hootsuite Reports quite a bit, and Hootsuite we've been using for a while. Hootsuite Reports is kind of new to us, but it's kind of amazing. I would call that varsity level Twitter stuff, and so I didn't touch on it too much here, but if you guys really are getting involved in in Twitter and have a team of people working on your Twitter campaign, Hootsuite is an amazing tool. It's HOOTSUITE, Hootsuite, and it's incredible.
Okay, Mike, it looks like maybe we can get to something a little bit quickly. Valerie had a question about if you could address quickly, and then Pedro, you have your hand raised. Why don't we first see, Valerie asked Mike, what are some other public health focus areas besides diabetes that you've found on your tweets?
When we tweet about diabetes, it's very diabetes focused. We have run into just general obesity and some other things on physical activity, but the work that we do is so diabetes focused that's kind of where our Twitter campaigns have focused.
Okay, we're going to take one last question from Pedro. Pedro, you had your hand raised. You unmute your phone. You can do *7 to ask the question, and then we'll wrap it up and move on to our next presentation with Megan. And I'll just let everyone know, including Monica Levy, that if we didn't get to your question, please type it in, or you have your hand raised and we're not able to get to you, please be sure to type it in the chat box, and anything that we weren't able to address, we'll be sure to try and get that into the resources that we send out at the end of after the webinar is over with a link that we send out afterwards. So Pedro, if you want to ask your question, we'll take that last question.
Great, thank you. I'm hoping you're able to hear me.
Great, Pedro.
Yep.
Okay, great. Mike, thank you for your presentation. We're running into an issue here in Hawaii that we are using Twitter. I work specifically for the Hawaii Tobacco Prevention Control Trust Fund. We have an ample amount of followers, but we're trying to figure out how do we, we're targeting Hawaii, but Twitter is global. So, and our content is being able to be accessed, more outside, more than just Hawaii, unlike other social medias where it's more targeted. So how do we expand our resources? How do we figure out, sometimes you can't tell if somebody's from Hawaii or not, so we're trying to figure out, how can we become more focused on the population that we're supposed to be targeting through Twitter when it's so global?
That's a good question. Luckily, my organization is global, so I don't have that exact issue. There are certainly challenges that we face because of that, but I would suggest you find power users in your community. So people that are maybe news reporters or local celebrities, somebody who has a lot of pull in the local community that isn't really global, and kind of see the people that they follow, the organizations they follow, and try to get in that market. I would also check out if there's any sort of hashtag that's used locally. I live in the Bay Area, and there's every city surrounding me has its own hashtag and conversations about that city. So try to dip into those conversations with relevant content. Don't just promote links, but try to see how you can relevantly include yourself in those conversations. That would be my suggestion.
Thank you so much, Mike. We're going to wrap it up, but like I said, if anybody else has any other questions for Mike, please be sure to put it in the chat box, and we'll try to address that in the resources we send out later. And we're going to segue now to our presentation with Megan, who is going to share about Facebook. And I want to tell you a little bit of information about Megan. She's marketing coordinator for the San Francisco AIDS Foundation. Megan oversees the development and management of public health campaigns, social media, social marketing, and public forums. She's also responsible for handling community affairs as they relate to increasing the public's understanding, value, and support of the Foundation's work, as well as their HIV literacy. And Megan received her Master's in Public Health from University of California at Berkeley. Go Bears! So Megan, take it away.
Great. Thank you. Welcome everybody to the webinar, and thanks for joining in on our presentation. The main focus of what I'll be talking about is Facebook and how we've used it here in our work at the San Francisco AIDS Foundation. And to give a quick rundown of what I'll be talking about, here's a brief overview of my agenda. So first I'll start off at the 50,000 foot level and work my way down, like explaining what our goals are for using social media and how does that fit into the bigger picture. And then I'll present a case study of what we've done here at the San Francisco AIDS Foundation in developing our strategy and best practices. Then move on to talking about an application of how we've integrated Facebook into one of our social marketing campaigns called Many Shades of Gay. And hopefully by the end you'll find some useful nuggets of information that'll be helpful for your social media efforts with takeaways. So big picture. To give you some background of our organization, San Francisco AIDS Foundation was started in 1982, and we are one of the oldest AIDS service organizations in the country. 30 years into the epidemic, our vision is to eventually see the day when San Franciscans and everybody else beats HIV. In terms of, we provide free services to people in hard-hit neighborhoods and advocate for them, to elected officials and everyone else in our community, because we believe that HIV is not inevitable. And currently our working mission is the radical reduction of new HIV infections here in San Francisco. And here's just kind of a mini bullet of our strategic plan of our 3 ambitious goals that we hope to achieve by 2015, which is to reduce half the number of annual new HIV infections in San Francisco, ensure that all people who live in the city know their current HIV status, and ensure access to proper HIV care for all those who need it. And the reason why I go into kind of what our mission and vision of the organization is taking it down a little bit, is just providing context of what are we actually trying to do. So my role as marketing coordinator, a lot of my work is focused on building awareness, and so it's my job to make sure that people know who we are in the community, and also to make sure that people know that HIV is still a prominent issue. So starting out at the bottom of this circular logical model here, and I'll work my way around. My job is to build awareness about my organization's work in HIV, and by building awareness, hopefully it opens the doors for people to come in either as a client, a volunteer, a donor, or my personal favorite, brand advocate. And hopefully by building awareness, and here I'll use these things, by building awareness, hopefully it brings people butts into seats, as we like to call it. Seats being clients, volunteers, donors, brand advocates, and basically we want people to come to our events and we want people to support us. So whether that's through dollar signs, signing a petition, providers referring people to our services, people volunteering for us, or people just generally spreading the good word about all the good work that we're doing. Moving along, it eventually connects back to our programs and policy work by ensuring that clients get connected to our HIV prevention and care services, and then on the same token, making sure that those programs are available to the people who need it for free. And so closing the loop, this is where our work comes in. We publicize the great work and the impact of our programs and policies. So we showcase client stories, we hold events and activities, and through the different communications channels that we use here. So that includes our website, our email newsletter, Facebook's a really big one, Twitter, Beta Blog is our blog that we have that we publish daily, and then the different campaigns that we distribute out into the community, which then hopefully, ta-da, builds awareness. It's a never-ending cycle, but hopefully that kind of gives you, it'll help explain kind of what we're doing with Facebook. So to give you brief background on kind of my role and how Facebook works into our organization, I came on staff in the beginning of 2011. And at that time, the organization was kind of into Facebook, but not really. They were really interested in investing more into it, but didn't really know how. So luckily, there was buy-in from the leadership level where both the CEO and the Vice President of Public Affairs saw the potential value of social media. And they specifically saw it as a unique opportunity to connect and build dialogue with our current supporters who are already familiar with our work, but then also engage potential new ones who might not have heard us about us before. So my goals were, which I realize I'm probably sounding like a broken record player, but it's to increase awareness and understanding of our work and increasing people's HIV literacy. So this is kind of like the play-by-play rundown of the strategy that we set forth with. So step one, build a fan base. In the beginning, we had maybe 1,000 fans. So we used a variety of different strategies to build those numbers up, one of them being paid promotion, so Facebook advertising. And then we also did non-paid promotions, which included cross-tagging other organizations, so like-minded peers, and then interacting with other Facebook pages. And then in terms of the paid promotion, sorry, I forgot to mention, I had a dedicated budget for specifically that effort and had target numbers that I had to reach in, that we set out every quarter to figure out that we were growing at a good trajectory. And then after a period of significant growth, we moved on to step two with engaging with fans, because we wanted to make sure that once people were opted in to like us as our fan, we were engaging with them in a way that was both beneficial for them and us. So we found metrics that, we found metrics using Facebook insights that we thought would be useful to help us figure that out. And then from evaluating those metrics over time, we developed our best practices. So here is a rundown of how step one looked like for us in the year 2011. So like I said before, in 2011 we had 1,000 fans, and then by the end of the year we had close to 12,000 fans. And to give you context, that's a 12,000% increase in fan growth. So we grew by a lot. And to explain the chart, it's broken down by quarters, and so each quarter shows how many new fans we grew by, how much did we spend, and how much did each of those fans cost. And so to point out the high and lows, in quarter one is where we saw our largest growth of 5,000 folks or fans who came into our Facebook community, and it was also where we spent the most amount of money. Compared to our low period in Q3, we didn't spend any money, and it was also where we saw the lowest amount of growth. So the key takeaway that I want to just impart is that we learned comparing our Q1 and our Q3 that in order to grow your fan base, you must be willing to spend money in Facebook advertising. So basically, you get to buy all your fans or your friends. And then the second point that I want to point out is that we were able to drive down cost per fan as the year went on by creating with the Facebook advertising that we were putting out. So industry standard, which this might be old, but this is pulled from, I want to say, 2010. Industry standard says that Facebook fans cost about $1.09 per fan. And so if you want to go follow from Q1, we saw that industry standard with like $1.07. And then we got better at strategically targeting the ads based on location, special interests, using other like-minded groups, targeting things that we thought our community would be interested who might not already be fans of us, and we were able to drive those costs down to eventually under 50 cents per fan. So that was super helpful with building our numbers up. And you could probably hold a separate workshop on how to effectively use Facebook ads, since there's a lot of ways to do it. But the one thing that I do want to note is that you do have to invest a significant amount of time, both with financial and staff resources, to make sure that it works for you, because there's a lot of monitoring that happens to make sure that your Facebook ads are working. So that was step one. Step two, this is a quick snapshot of Facebook Insights. So after we had about 6 months of significant fan growth, we started concentrating our efforts on how to keep people engaged with us. So this is where metrics come into play to make sure that we know that we're keeping people engaged. And so as a Facebook page admin, you get access to a lot of back-end data about your Facebook community and your performance, both on the page level, which is shown up here, and then the post level, which is shown down here. And so the trick is figuring out which metrics are the most useful for you, because Facebook gives you a lot of data. The ones that we focused on, since we were most interested in increasing our number of supporters and then making sure that people were engaging with us in a useful way, were likes, which isn't shown on here, but then reach is something that we focused a lot on, because that basically means the number of eyeballs or impressions of people who saw your particular post. And then engaged users is something that we focused on a lot, because this metric tells you the number of people who clicked on your post. And so basically, and the other ones, we didn't necessarily focus on those because we didn't feel like they fit into the goals that we were working towards, so we just focused on these two. And we would track these metrics and analyze them on a weekly, monthly, and quarterly basis to kind of explore what, when, and how fans were engaging with our content. And it allowed us to identify evidence-based common patterns, themes, and best practices. And so this is a general rundown of looking at the numbers. These are our top 5 best practices that we found worked well with our Facebook community. And I will make the caveat that your best practices may look a little bit different. They may look the same, but this is what we found from the data that we pulled from Facebook Insights. So because we are an HIV AIDS service organization, HIV content resonated really well with our community, and because we live in San Francisco, so did LGBT content. We found that in terms of the times to post, key workday hours seem to work the best for us. So when people get into the door in the office, at the lunchtime period, and then as people are heading home. My theory with that is people in San Francisco and the Bay Area commute on buses and public transportation, so they're always on their phones during those hours anyways. And then some of these may seem like no-brainers, but it was nice to have data to back up that Facebook is very visual, so pictures worked well for us. And then in terms of engagement, asking a question at the end of the post solicited a lot of people to respond in the comments. And shorter posts resonated well with our community because long ones just didn't perform as well. So that's kind of the quick rundown of our top 5. And we're always constantly tweaking and playing around with the different types of content and posting strategies to see what works and what doesn't, because as we keep growing our Facebook community, these best practices may change just depending on the makeup of who comes in or who opts in to like us. So we're always keeping a pulse on what our community is interested in and kind of just testing things out. And also, because Facebook likes to throw curveballs, it's also nice to kind of see when things are happening on the Facebook back end, because you can tell that from the data too. So you might be asking, why should I care if people like our pages, or why should I care if they're commenting or sharing our posts? This is one of the reasons why. So which is similar to Mike's presentation with linking back to kind of getting more support for your organization, we took beyond Facebook Insights, we took it one step further and connected Facebook traffic to our website using Google Analytics. And so we analyzed a specific URL from one of our online fundraising campaigns, and looking at all the website traffic sources to that specific URL, we found that fans who got to our website via Facebook were more than twice as likely to click on this specifically tracked donation landing page, so the URL, than other website visitors. And for us, this finding was huge. It made the case for how Facebook helps us with our work and it follows the butts and seats mentality. And so we saw the opportunity of, we have this population of engaged stakeholders, our Facebook community, who are being primed because they like our page already and they're receiving our posts in their news feed, receiving messages about our services, our events, the work that we're doing, and they're one click away from going to a donation page, which is much closer than a general population member who's just kind of walking in the streets. And so we saw this as a huge potential to further our strategic goals within the foundation, and pointed out to a huge opportunity to strengthen their connection to our organization, to kind of steward them along to eventually become a donor with giving support back. So we've used this finding to kind of build upon in our future campaigns to kind of see how we could leverage our Facebook community to help us with this type of support. So because Facebook's always changing, this is kind of a roadmap of what we're focusing on in 2013. Content marketing is becoming more and more of an issue that I'm hearing in the blogospheres, and it's becoming really important because engagement is so key when you're building a Facebook page. Just because you have a lot of friends, if you're not engaging with them in a useful way, then it's not very useful for them or for you. So the things that we're focusing on is just kind of figuring out the right mix of photos, what kind of keywords resonate well, and then what kind of links. So kind of just diversifying the different types of content that we post out. And then trying different subject areas. Right now we know that if we post something that's LGBT related and also has like a celebrity shout out, people seem to really be drawn to that. And then in terms of numbers, we were trying to figure out how many times can we post without overburdening our fans, or how little can we post before they so that they're still connected to us. And then with promoted posts, since that's a new feature that's kind of popped up on the Facebook scene within the past year, we're still kind of figuring out what's the right paid mix, because since we used Facebook advertising so heavily with building our fan base, we're now using promoted posts to help build engagement. So because only a small percentage of your Facebook fans actually see the post that you put in your newsfeed. So even though our Facebook page has 22,000 fans, only about maybe 10-15% of them actually see that particular post. So by promoting it, it pushes that content on someone's newsfeed that's not in real time, just making sure that you get more eyeballs. And so we found the most success with doing promoted posts with content that we want to make sure that people see. So that's internal content that we publish out with articles with client stories, and then also any upcoming events that we want to make sure to put on people's radars. And then one thing to also note with promoted posts, you have the option of promoting it with people who are in your existing fan base, or you have the option of doing your existing fans and then friends of your fans. We've been focusing mostly using promoted posts with just folks who are already in our fan base and not targeting their friends, just because given our subject area, it gets a little sensitive to push out content that's HIV or LGBT related, especially if those friends aren't expecting it. And then because I love brand advocates so much and because of the case study that I just presented, I've been trying, my goal is to convert our Facebook fans to sign up for our emails, so to even opt them even more into our organization and extend the brand relationship. So that's the Facebook case study. And here is an application of how we've integrated social media with our social marketing campaign initiative called Many Shades of Gay. If you aren't in the Bay Area, you might not have seen these ads, but this is an example of one of the many ads that we had blanketed across the city that we had on buses, billboards, the internet. We had a really heavy push on social media. And just to give you brief background on the campaign, we launched this in mid-June of 2012, and it was focused mostly on gay and bi men living in San Francisco, and we produced it in collaboration with a pro bono team from ADDIC, which is an advertising agency located in the city, and had key partnerships with our Department of Public Health, ISIS, which I'm really excited that Sharon's also going to be presenting later on this webinar, and then other San Francisco peer organizations like Asian Pacific Islander Wellness Center, Mission Neighborhood Health Center, and others. And the goals of this campaign were to increase awareness of testing recommendations among gay and bi men regardless of risk behavior, and then also increasing linkages to HIV testing locations. So basically, if you're walking around within San Francisco during the months of June, you saw this ad, and at the heart of the campaign is it's telling you to visit manyshadesofgay.org, which is this interactive and educational website that it encourages you to create a personalized avatar. So here is a snapshot of what you would encounter if you went to the website and created your avatar. As you can tell, there's lots of different options for users to choose from with your body, anatomy, shirts, jackets, pants, socks, everything under the wahoo. And once you created your avatars, you were prompted with health messaging to go get tested or get linked to care. And so the website invited people to keep, sorry, let me back up. Once you created your avatar, you were encouraged to save it, and once you saved it, you were encouraged to share it. And so you shared it on social media, which looks something like this. You could download it as your profile picture. You could download it as a cover photo. And so by sharing it on social media, it encouraged your friends to join in on the effort too, and to also switch their Facebook profiles as well. And so as you can see, we had a dedicated cover photo for our social media efforts, which we also encouraged people to share during our push. And we pushed on National HIV Testing Day, which coincidentally happened to also be during the Gay Pride weekend within San Francisco. And so during this time period, it was really exciting to see all these people's profile pictures switch over to the different avatars they were creating. And to give you, just because I love numbers, I'm going to just go through a brief rundown of how the campaign has performed so far.
Megan, sorry to interrupt. Just wanted to let you know we have a few more minutes, and then we'll need to wrap it up and move on to Sharon.
Great.
So just giving you a little bit of a timekeeping. Thank you.
No, that's totally fine. So I will just let you know that a lot of people have visited the website. A lot of people have made avatars, over 900 so far. In terms of achieving our goals, we've connected people to HIV testing locations because we had a testing map where people could submit in their zip codes in a search box, and then it would give them a list of the nearest testing sites to them. And then we also, which is where our partnership with ISIS was so key, we gave people had the ability to set up texting reminders. So every 6 months, if they opted into this service, they'll receive a text message reminding them to come in for their next HIV test. And then this just showed the number of people who visited the HIV-related content. So just proving that because people were creating the avatars, they were also still interested in learning about HIV. And then, sorry, to quickly wrap up, the main takeaways, which hopefully nuggets that you guys found throughout my presentation, is one, buying your fans we found was the most effective way to increasing our fan base. In terms of fan engagement, focusing on content is really important because that's something that you can't buy. Because I love numbers, evaluating your efforts is also really important, while also utilizing multi-channel promotions and then making sure to link back that social media like Facebook and Twitter that has huge potential to further your organization's goals. And so that's the end of my presentation. Here's my contact information if you want to contact me about what we've done with Facebook or even learning more about Many Shades of Gay, because as you can probably tell, I could talk about it for days. But I guess we'll open up the floor to Q&A.
And I'll just mention what we're going to do in the interest of time, and I'm sure it's going to work out. We have some great questions on Facebook from Adam, Lucinda, and as well as Valerie and a few others. What I'm going to do is we're going to bridge right over into Sharon's Facebook presentation and hold the questions and answer at the end of that presentation. So we'll keep a monitor on that. Please keep asking them. And as I mentioned before, if we're not able to get to them verbally today, we will definitely field it with our wonderful presenters and get that to you in the resource document that we'll send out after the webinar is over. So what I'd like to do, great job, Megan. Thank you so much. And our final presentation is going to be from Bhupender Sharan, who's the Deputy Director and Vice President of Programs and Partnerships with ISIS. He's a public health professional based in Oakland who began his career as a medical doctor in India and then later moved on into public health and got an MBA in health management from the Institute of Health Management Research in India, as well as curricular training at Johns Hopkins. Since then, Sharan has worked in South and Southeast Asia, as well as the U.S., in varying roles with nonprofit agencies, the United Nations, and in academic institutions addressing the health needs of diverse populations. He's worked in strategic planning, designing, and implementing social marketing campaigns, research, and program design. And in his current role at ISIS, Sharan works with the program team to design various new media and technology programs. And welcome, Sharan, and take it away.
Thank you, Lisa. Hello, good afternoon, everybody. My name is Sharan.
And Sharan, if you could speak a little bit louder, I seem to not hear you quite as well. It would be great.
As Lisa said, I'm the Deputy Director at ISIS. So we know that social media has taken the world by storm. And when it all began last decade, people started asking questions on whether social media could be used to improve health, could it be used to mobilize communities. And we as an agency were also asking those same questions. And so today my presentation is going to be on a study that we did called Just Us that was essentially designed to answer those questions. The concept of the study began in around 2006, and I'll give you further details later on in my presentations. We designed the study in collaboration with the University of Colorado, Denver, and ISIS and University of Colorado, Denver School of Public Health worked together to submit a proposal to NIH. For those folks who are not familiar with ISIS, we are a nonprofit based out of Oakland. We work with youth and young adults, predominantly youth of color, focusing on sexual and reproductive health, and our niche is in using new media and technology to do our work. So what are we going to do today in this presentation?
Sharan?
Yes?
Sorry, we just had a few people let us know that the volume's a little low. Can we maybe put that up, or can you speak a little bit louder, and we'll do a test?
Better?
I think that's better.
Great.
Great,
so,
thank you.
Appreciate that for letting me know. So in today's presentation, I will give you a bit of a background about this NIH-funded study. Then I'll explain to you how we implemented this Facebook intervention, and then lead into lessons learned around content and engagement, and also a couple of takeaways. When we did the polling at the beginning of this presentation, 60% of you said that you wanted to take Facebook or social media to the next level, but there were also a few of you who are just beginning to take off on social media. So hopefully at the end of this presentation, you will have some evidence that social media can be effective for health messaging, specifically in this case for HIV prevention messaging, and creating short-term behavior change. I don't know about you, but in my work in social media, I've had to face several challenges. One, in convincing my superiors to incorporate social media into our work, and also the rest of the agency to participate in social media. At the same time, going out for my programs and trying to get funding for social media in my programs, the question I constantly keep getting asked is, what's the evidence? So there's a bunch of literature that exists out there around trends and demographic data around users, but there are very few randomized control trials that actually demonstrate the effectiveness and efficiency of this channel, and this Justice study is one of those. All right, so before we start, a quick recap on a couple of things, and I'm sure most of you are aware of these data. By the birthday, 7 out of 10 teens have had intercourse. Even though a quarter of the population is 15 to 24, nearly 50% of all new STI cases are in this population. And young people age 13 to 24, they make up 17% of all HIV diagnoses in 2008. And for those folks who have been keeping a watch on CDC's vital signs, that number is now 26% of all new HIV infections among 13 to 24-year-olds. And most of these infections are among people of color. So if that is what's happening around health, what is happening around the use of technology and communications? We know that 73% of all teens, 12 to 17, are on social networking sites. This number is increasing every day. Initially, there was this conversation around the digital divide that existed because of economic status, but that is not true anymore. That digital divide has vanished. If there is a divide, it's more generational in terms of how the younger population is using social media as opposed to the older generation. And more than 66% of young adults, they log into their social networking sites weekly. That is great stats for any of us that's interested in working in social media. Now consider this. An average 16 to 24-year-old spends 70 hours or more in front of one or more of these screens, a TV, a cell phone, or a computer. And sometimes they do it all together. They have all the three screens on at the same time. And when you look at social media, Facebook is it. It's become the microcosm of the internet. And 80% and more of the youth are using social networks for everything. That's where they get the news. That's how they communicate with each other and chat with each other. So with that in mind, what was the Justice study? So in 2006, social media was really coming up. And the big question that was being asked by everybody was, can we use this channel to communicate with our audience? Can we recruit them into studies or interventions? And can we create any kind of behavior change? And we had those same questions, so we went to NIH to get monies to test this out. And initially we said we would use MySpace because MySpace was big during that time. But by the time the study got funded, MySpace was out and Facebook was in, so we had to go back to NIH and change the study from MySpace to Facebook. So this current slide gives you a very brief framework of what that study looked like. We targeted 16 to 25-year-olds, U.S. residents, who had a Facebook page and who were willing to participate in the study. We used respondent-driven sampling and got informed consent, did a baseline assessment, and then divided the eligible participants into an intervention group and a control group. And I'll explain what that was in a little while. And then we did a follow-up survey at 2 months and at 6 months period. So we created 2 Facebook pages for the study. One was the intervention page, which was called the Justice page, and the other was 18 to 24 news. That was the control page, and we randomly assigned the participants into these 2 groups. The Just Us intervention page had HIV prevention messaging, and we used focus groups to develop those messages, whereas the 18 to 24-year-old had regular entertainment and other types of news not related to HIV. By the end of the study, we had recruited 1,500 participants aged 18 to 24. We did the initial survey, and then we did 2 follow-up surveys at 2 months and 6 months. The research question that we were asking was, can exposure to sexual health content on Facebook change knowledge, attitudes, and risk-taking behaviors? So what happened with recruitment? The predominant majority of our participants were female and African American and Latino. And we also had Asian, Pacific Islander, and Caucasian participation as well, but that was limited. In terms of where these individuals came from, they were all over the country, but the predominant majority of them came from the South, the West, and the Mid-Atlantic. The most important thing was the content that was created for the Just Us page. We went out into the community, we spoke to experts, and we developed what we call the content matrix for this intervention. We had 8 weeks of messaging, and we developed several themes, and the messages were developed based on those themes. What you see on the slide is an example of one of those topics. In addition to that, we also created a website that we could refer people back to get more detailed content and information and access to resources. To make it exciting and visually stimulating, we created videos. We also posted weekly blogs and put up several other topics and timely information as well in terms of newly released reports, what current events that were relevant to our study were happening around the country, and any research studies or papers that were relevant to our content as well. And so what was the outcome? We were able to demonstrate short-term behavior change at the 2-month survey. 68% of the intervention group reported using a condom during the last sex act, as opposed to 56% of the control. And the proportion of sex acts protected by condoms was 63% for the Just Us group versus 57% for the control. And these were statistically significant findings. Unfortunately, this impact actually was not demonstrated in the 6-month follow-up. So we were able to show short-term behavior change, but not long-term. In terms of engagement, what was successful was using current events and issues in the news, and we put in topics that would generate controversy and generate opinions and conversations from our participants. And we also put out questions with call to actions. The website reached 1,000 views per week, over 160,000 post views, and we got around 1,800 unique site visitors. What was successful in terms of engagement? Initially, when we started the post, we very quickly realized that somebody like me putting up the post did not work. We had to recruit interns from the community because it was the voice and the tone that was very, very important in engaging the community and generating conversations and discussions. And this community is very, very sensitive and very smart, and they can quickly realize who is the person who's putting up the post. And me, as somebody who did not belong to this community, putting up posts did not really work. And the interns that we recruited from the community, when they were putting up the posts and generating engagements, that was what really worked for us. And these were the interns who were active on social networks. They brought in their own voice and perspectives and stimulated the conversations. So in conclusion, in terms of content, what worked for us was putting up content that was age and culturally appropriate. It had to be medically accurate. A lot of our links that really worked and were used were those that had CDC and WHO in them. The posts needed to be relevant, and they needed to generate some sort of controversy, if I may say that, to create a buzz. And driving discussions and engagement using interns from the target population community is what really worked for us. When we look at social media today, and this was true, earlier on as well, online banner advertising is becoming really cluttered, and if you try to do that, people do think that you're spam and don't pay attention. And one of the things that worked for us in terms of recruitment was when we tried to do purely online recruitment, that didn't work very well for us. what worked for us was an integration of on-the-ground and online recruitment. We went out into the community and we identified seeds in the community. These were individuals who were actively posting on Facebook and who had a significant number of followers or friends on Facebook, and recruiting them, training them around our study, and then getting them to be interns and also as seeds in the community to increase recruitment is what really worked for us to reach our sample size. And with that, I think I would like to thank several people. I'm not going to name all of them over here. And here is my contact information. If you need more information or access to the study articles, please feel free to shoot me an email on this number or give me a call. Thank you.
That's great, Sharon. Thank you so much. And thank you also, Megan. And I mean, on both your parts, some really in-depth information in terms of how you used Facebook very specifically to meet your own objectives, as well as sharing some really great strategies and some amazing numbers. So we're going to take a little bit of time now. We have some time to answer questions for both Megan and Sharon in terms of Facebook best practices, and so please submit those in the chat box. And it looks like we had some previously. We have a question here from Adam, I think that came in during your presentation, Megan. Was curious about the fans that came from Facebook ads versus those that are organic likes. And the question was, did you track that? Was there a difference in their level of engagement and any likelihood to donate?
Thanks, Adam, for the question. In terms of tracking Facebook fans' behaviors, ones that came to us organically versus ones that came to us with that we paid for through ads, we, to my knowledge, and Sharon and Mike, you can correct me if I'm wrong, I don't think Facebook Insights gives you that level of detail of fan behavior to be able to track that in terms of their difference in level of engagement. And then to your second question with likelihood to donate, that's also just lumped together as Facebook traffic when we look at it on Google Analytics and tracking the different URLs that we're looking at. Hopefully that answers your question.
Great, thanks, Megan. And also, it looks like Valerie has a question for Sharon about how did you make your website Facebook less cluttered?
Hi, Valerie. Thank you for that question. So this is something that we have been trying to incorporate as a principle in terms of our websites and social media pages, which is what kind of visual content goes up there and other kind of content. And one of the things that we keep hearing back from the community, which is quite intuitive, is that people like clean websites, clean pages that are not cluttered. So what we have done is been very intentional in the kind of content and the visual and audio material and collateral that we put up on our website on Facebook. Facebook, it's easy to not let it get cluttered because we can be very intentional in what we put up there. But in terms of websites, putting up predominantly video and audio that is relevant to our community and the work we are doing, and also putting in pages that have a lot of links that can take people to other places for more detailed information that we don't necessarily need to put on our website. One of the things that we do know is that there's a bunch of content that exists out there right now, and we don't need to be reinventing the wheel around that. What is much easier for us is to identify that content and put up links on our website or add links to our Facebook posts so that we can refer people to good content.
Great, thank you, Sharon. I also wanted to put out there, I know, Megan, you responded, but Stephanie Goss had a really good question that's probably applicable to many in our audience in terms of if you're working somewhere where you don't necessarily have a large advertising budget to do Facebook, what can you do in terms of, let's see here, let me get back here to that. trying to get to Stephanie's question. Well, I think the question was, Megan, maybe you can put it out there for everybody in terms of how can you build engagement if you don't have the funding to do a larger advertising budget?
Yeah, and Stephanie's question was great. It was mostly around kind of if you don't have access to a budget or if you don't have money available to help with your social media efforts, how do you effectively do what you're trying to do? And so my response to Stephanie in the chat box was you definitely don't need to have a large advertising budget to do Facebook or Twitter. I think first step would be defining the goals and kind of what numbers you're trying to hit. So that's where the metrics come into play, because I think that largely that will help you figure out kind of like, okay, what's the low-hanging fruit of how I can get fans? Is that through a monthly newsletter that we already send out, so it's a matter of just putting the ask in the monthly newsletter? Is that asking people who already are fans of your page to share your page with their friends to help build your community? Is that cross-promoting other peer organizations in your link so that it shows up on their wall? There's a lot of ways to connect and build your audience that don't involve money. From my presentation, I think we found that advertising did help us a lot, but it doesn't mean that you aren't able to reach the numbers that you're trying to reach if you don't have the budget within your different programs. And then Stephanie followed up with a question asking for more strategies to get around the new Facebook news feed algorithm, because with the promoted posts and the organic feed, some things show up your news feed, some things don't. And that I'm still trying to figure out that question, because Facebook EdgeRank, or what shows the algorithm that Facebook uses on their back end changes on a seemingly daily basis. So that's where, on my part, with my role, we're always testing content and different posting times out to see what pushes our content up at the top of people's news feeds the most. Hopefully that answered.
Thank you, Megan. And we do have some time. I had a question for you, because we did have some people that hadn't started yet in the audience or just getting started. And we've oftentimes in previous trainings had questions around how, when you're wanting to get started, how do you have that important conversation with your funders and or with upper management about communicating the value of using these tools and getting buy-in. And I'll open that to all of our presenters if there's any recommendation on having those conversations that you might be repeatedly having, even if you're adding on, say, a new tool in addition to Twitter or Facebook in the social media world.
Hi, Lisa. This is Sharon. Maybe I can jump in here. So this is something that we constantly face, even though we have been working in the field of social media for a while now, going out to funders and convincing them to give us monies to do outreach or integrate outreach for social media or integrate social media into existing programs. And that is where I think evidence becomes really, really important. And so what we have done in the past is look at existing literature, and there's a bunch of that exists out there. And so go online, identify and find that literature. There are a lot of demographic trends, a lot of new media and technology trends. Pew Internet Research is a great resource to identify, to get that information. Look at the TechSex USA paper that ICIS published last year. Studies such as Justice that I just described as a randomized control trial, which a lot of people think is, the pinnacle of evidence. Identify those studies, identify the statistics that are relevant to your argument, and then use those to convince funders and superiors that this could work for you.
I agree with that, and I would maybe just add that finding people that are doing the same thing that you would like to do, and they're doing it well, trying to maybe see how they're doing it and communicate that to people as well.
Great. Okay. Well, any final thoughts from our wonderful presenters? Any one last, in one sentence, if you were getting started today, try to do this?
I would say just do it. Just get started.
Just do it.
I agree with Mike. Yes, please just do it. As you jump into it, there'll be a learning curve, a sharp learning curve, and as you get more comfortable with it, you will get better at it. One of the keys to social media is what I call listening. And so at the initial start of your social media campaigns, definitely listen to what's happening in the social media sphere, because that will really help you in understanding what the trends are, what's working, what's not working, and what you need to do to be effective in this field.
And I would echo what everyone else has said before me. Just do it.
Great. Well, thank you, everybody. We're going to go ahead and wrap up our session today and our conversations. And we did mention that we will have some resources. These are just a few. Mike had mentioned some links. We are going to put those as well as a kind of compilation of some of the questions, because there were some comments and questions that we weren't able to get to. We will put that on a resource document with additional resources than those that you see here, and send that out after the webinar is over in the next day, along with a link to the recording of the session today, as well as links to the slides. And I do want to let you know that after the webinar is over, we do have a brief post survey that we'd love for you to take, because we are always interested in feedback and improving what we do. And one of the things we'd really like to have you reflect on is, and do if you'd like, is what action step, and as our speaker said, what can you just do after having listened to these best practices in terms of using Twitter and Facebook in your work. What do you think you could do in the next month to further your goals? And let us know. We do have in the survey an option to check a box yes, and we will check back with you by email to see your progress, because we do love to hear how everyone's putting into practice what they're learning. And as I said, we really appreciate your feedback. So in closing, I just want to give a big shout out and thanks so much to our fabulous presenters. Some amazing work going out there. I can't wait to listen to the recording and really take some in-depth notes, because I learned a lot and really want to revisit it. But their contact information is here. Please feel free to email them if you have some questions. And then also, if you have questions for us in terms of the session, please let us know and contact us here. This is the first session in our latest 21st Century New Media training series. And we do have 2 more webinars that are going to be coming up. Our next one is on blogging best practices with Anita Jackson from Moms Rising. And then we'll also have a webinar on best practices for webinars and webcasts. And then an additional in-person 3 workshops held here in Oakland. So check it out. And once again, thank you so much to our panelists. Thank you to all of our wonderful participants in the webinar. I hope this has been useful and inspiring for you. And I'll close by just saying, just do it. And thank you very much. Bye-bye, everybody.
Thank you. Please stand by.